out of the marketplace. So I'm very pleased to be here with Dr. Morris. But I'm also pleased to be here with Kim Moldovsky, who's going to be speaking to us, Moldovsky, I'm sorry, from Morton Grove, Illinois. Kim, thank you very much for joining us to give us your perspective.
Thank you, William Horner. Hi, I'm Kim Moldovsky from Morton Grove, Illinois. Agliophobia is a fear of pain. Iatrophobia is a fear of doctors. But I've yet to find a word that defines my biggest fear, fear of pre-existing conditions. My fear of pre-existing conditions began years ago when I was diagnosed with Sjogren's syndrome, an autoimmune disease that causes dry eyes and dry mouth. My illness seemed more of a nuisance than a health crisis, so I was shocked when, after my husband's employer went bankrupt and we lost our medical coverage, I was repeatedly told that I was uninsurable due to this condition. That was back in 2001 when I was 33 years old. Eventually, my husband found a job with benefits. After a period of time, my faulty immune system was covered in full, which was helpful because by then I had developed rheumatoid arthritis. Still, once it was diagnosed, I found the right combination of medicines to combat my symptoms, life continued at a normal pace. We were happy to have medical insurance, but we didn't have a great policy. We had a $5,000 deductible for our family, and with 2 young children underfoot, we often met that deductible. At one point, I realized our high-cost, high-deductible policy actually penalized us for using the plan. For example, by using the mail-order pharmacy aligned with our plan, it cost me over $2,000 a year for a certain medication, a certain arthritis drug. On my doctor's recommendation, I checked the prices at the local Costco. It turned out that this same drug cost me less than $300 a year without my insurance at Costco. In the fall of 2008, my husband lost his job and eventually his benefits. This time, I felt fortunate to find a private insurer, saving me the expense of the state plan. However, like many policies, it does not provide coverage on the issues that matter most to my family. Even my 9-year-old son has a pre-existing condition that's not covered. And of course, my arthritis, well, they accepted me into the plan with a special deductible for arthritis-related treatment. Knowing that this typically only involves a couple $1,000s of treatment a year, we felt okay with that. However, it wasn't until after we'd signed on the dotted line, the only dotted line that was available to cover my entire family, that we learned this deductible, which I assumed was $5,000 or $10,000, was actually a $65,000 deductible. A $65,000 deductible for the most pressing medical condition in my family. It's not creaky bones that keep me awake at night. It's the fear of developing a condition related to my arthritis that could send us tumbling into bankruptcy. Although I have some coverage, I have a fear of unexpected news, odd test results, a new diagnosis. I have a fear of a new pre-existing condition, a phobia without a name. Although we pay several $100s a month for access to quality care, I'm afraid to use it. I often ignore minor aches and pains. I've held off on some scheduled blood tests and exams, and I worry that my attempt to save a few dollars now could cost me dearly in the future if minor problems spiral into larger ones. But ironically, as long as people with pre-existing conditions can be denied coverage, spending money on doctor visits and tests to solve problems early on could actually cost more dearly in the future. I will now turn it over to Whip Clyburn.
Thank you very much, Ms. Moldovsky. A few months ago, I participated in a radio call show down in South Carolina. A gentleman called in and said he liked his insurance and he didn't want us to change the system. The next caller was a woman who said that she had recently been diagnosed with breast cancer. And for me, she crystallized what this debate is all about. She said, I thought I liked my insurance too, until I tried to use it. And went on to talk about receiving an offer letter canceling her coverage at her second treatment. People like that woman in South Carolina and Kim, who are struggling with serious illnesses suffer under current unfair practices of insurance companies. It's time to bring an end to discrimination based on pre-existing conditions. It's time to bring an end to rescissions or dropping coverage when a person gets a catastrophic illness. And it's time to bring an end to the fear that many Americans have that if they lose their job or they change jobs, they cannot get health coverage. It's time to do what generations before us could not accomplish. It's time to pass health insurance reform. Oh, Stella. Oh, Ms. Johnson?
Good afternoon. My name is Stella Johnson, and I am a retired school teacher from Washington, D.C. I am also a member of the Alliance for Retired Americans. Like many seniors, I must take prescriptions every day to manage my high blood pressure and high cholesterol. But unfortunately, along with over 3 million other seniors, I am in what is known as the Medicare donut hole. For several months of the year, I have to pay full price for my prescriptions, even though I'm still paying my Medicare premiums. In other words, I pay the money, but get nothing in return. For an example, in 2008, I received a letter from my insurance company stating that I would not receive any money for my medicine during the month of December. Now, you know how that is. That is supposed to be a very joyful month. However, I found myself during that time quite desperate, for I would not receive any money until the new year for my insurance began. I had to use my utility bill money in order to buy my medicine. And then, in order to catch up these bills, I had to even go to borrow money from my food money. I became quite desperate, and I didn't know what to do, because in times like this, it's very hard for me to make ends meet. I have to choose between taking the medicines I need and paying my monthly bills. Because my prescription costs so much, I fall behind on some of these bills. When I get hit with late penalties, things even get worse. The health care bill will help seniors like me who struggle every day to afford the prescriptions they must have. Retirees all across the country desperately need this bill to pass right away. Thank you. Now I'd like to turn it over to Chairman Lawson.
Thank you, Stella. Said so eloquently, as have all of our guests this afternoon. All of our guests this afternoon understand that this very important vote before us is, in so many respects, whose side are you on? And the vote this week will demonstrate clearly which side Democrats are on in the United States Congress. We hope that our colleagues on the other side, when hearing the same compelling stories that we know all of their districts here, will join us. Stella points out very clearly what happens to those who find themselves in the dreaded donut hole. We're going to end that process, beginning to correct it and solving it completely. We're going to extend solvency of Medicare, program that this great party of ours is so proud of. We will not privatize Social Security or voucher Medicare. We're going to continue to make it solvent. We're going to improve the quality of senior care with better coordination amongst doctors. Coordinated care, I just left a group of hospitals, is the most important thing. With the innovation and science that we have at our ability to make sure that they don't experience the senior shuffle, that they actually get the care and attention in a coordinated manner that they need, that they won't